So I want to talk to you today about what's called lifestyle medicine. And lifestyle medicine is the idea of using lifestyle not only to help prevent disease, but also to treat it and often reverse it, either in combination with drugs and surgery or often as an alternative to that. And our program, as I mentioned, really was a direct outgrowth of what I learned from Swami Satchidananda. It's a whole foods, plant-based diet that's naturally low in both fat and in sugar and refined carbs. Various stress management techniques, including yoga and meditation, moderate exercise, and what we euphemistically call psychosocial support, which is just another way of saying love and intimacy. And one of the things I love about Swamiji was that he could reduce things down to its essence. Some people can reduce things, make things simple out of ignorance, but others, like he can, if you really have a deep understanding, you can reduce it down to its essence. And that's what he did. And so to reduce this down to its essence, it's to eat well, stress less, move more, and love more. That's it. And we often have a hard time believing that these simple changes can make such a powerful difference, but they often do. And so our work has been, for the last 40 years, and it really has been 40 years, it's hard to believe. I did my first study in 1977, is to use these very high-tech, expensive, state-of-the-art scientific measures to prove the power of these very simple and low-tech and low-cost interventions. So I'm going to go through with you the research that we've done to show how powerful these techniques are, but to put them in a larger context of what, in my limited understanding, where healing comes from, both individual and social healing, and then to see where we go from there. I think after doing it for so many years, it's finally the right idea at the right time, because so many forces are converging at the same time that the limitations of drugs and surgery are becoming increasingly well documented. Randomized trials have shown, for example, that in the case of people with stable heart disease, that stents and angioplasties really don't work, that bypass surgery is effective in a very small percentage of people, that if you have type 2 diabetes, getting your blood sugar down with drugs doesn't work nearly as well in terms of preventing the horrible complications as getting it down with diet and lifestyle. If you have early stage prostate cancer, there was a major study that came out just a few weeks ago that after 10 years, men who did nothing lived as long as those who had radiation or surgery, although you end up getting maimed in the most personal ways in terms of not being able to have sex because you're impotent, wearing a diaper because you're incontinent for really little benefit at huge economic and huge personal costs. And at the same time we're seeing that these simple lifestyle changes can not only help prevent, but often reverse these conditions. And the only side effects are good ones at a fraction of the cost. And so what I learned from Swami Satchidananda was to ask a very simple, really radical question, radical in the sense of getting to the root of something, which is what is the cause? He was always saying, well, what's the cause of that? And what's the cause of that? And what's the cause of that? And there's a causal chain of events that generally leads to something. And the more powerful you can go back in that chain of events, the more powerful the healing can be. And I've been showing this slide literally for decades because it's been a guiding principle that we spend so much time in medicine and in life in general mopping up the floor without also turning off the faucet. And the problem is, if you don't, like when you get put on drugs to lower your cholesterol or blood pressure or blood sugar, and the patient says, "Doctor, how long do I have to take these?" The doctor usually says, "Forever." It's like, how long do I have to mop up the floor? Like forever. It was like, well, why don't we turn off the faucet? And what we're finding is that to a larger degree than we had once realized, that the faucet are the lifestyle choices that what we make each day, the ones we've been talking about. And when we turn off the faucet, what we're finding is that our bodies often have a remarkable capacity to begin healing, and much more quickly than we had once realized, if we can treat the cause. And all these things were thought impossible when I began doing this work, and part of the value of these research studies and why we put so much time and energy and resources into them is they can redefine what's possible. And by doing so, it really gives and empowers people with new hope and new choices that they didn't have before. It's a disruptive technology in the same way that an iPhone was when it first came out, or a Tesla, or anything like that. It's not just an incremental change, it's more of a quantum change.